Assessment in medical education is so important to ensure qualified, competent doctors to be produced. Among the various test methods are multiple choice questions, widely used in assessment at the undergraduate and postgraduate levels of medical examinations. They can test large sample of knowledge in a short period of time and require less time and effort in administering. MCQs provide ease, objectivity, and reliability of scoring. Well-constructed MCQs can test higher-order cognitive processing such as evaluation, rather than recoding an isolated fact. Consider the following question that assesses evaluation. The learner has to choose the most appropriate management to confirm the diagnosis. An example of an item that tests problem-solving ability, but they allow for guessing without knowing the actual fact, and do not test the student's ability to organize their thoughts. MCQs cannot test the ability to write logically or assess communication skills. Now let's look at the structure of an MCQ. The entire test question is called the item. The stem is the question statement or lead-in to the possible answers. The possible answers are called options or choices. The correct option is called the keyed response, and the incorrect ones are called distractors. A large number of MCQ formats are available. The one best response is the traditional and most frequently used, and it will be discussed into more details later in the video. Quality questions use good grammar, punctuation, and spelling consistently and minimize the time required to read each item. A good distractor needs to be below the correct answer and plausible or as near to the correct answer. Each item in an MCQ test should be addressed to test a significant learning outcome. So the first step in writing an MCQ test is to have a blueprint, planning each question against the learning objectives of a course. Another method is producing a list of topics or themes for each question, in a context that defines the clinical situation. When it comes to writing the stem, the leading part should be built on information in the stem and pose a clear question or a statement. Imprecise terms are not uniformly understood and should not be used. Negative words should appear capitalized if they cannot be totally avoided. When writing a clinical case, it should begin with age, sex, presentation of a problem, site of care, followed by relevant signs and symptoms, and the results of diagnostic studies. A context-rich stem stimulates students to think and resemble the real-life situation. When writing the options, 3 to 4 option items are effective, not more than 5. Options need to keep homogeneous in content and of similar consistent length, and repetition should be avoided. Options should be independent, not overlapping. Consider the following question. While D is the correct answer, it overlaps with A, B, and C, as the cell that has 46 chromosomes has 18, 22, and 32. When it comes to the negative form of a question, as all of the following are correct except this type requires a switch from positive to negative thinking, and a wrong answer may be due to failure to follow the instructions. So negative items may be placed together in a separate section with the negative aspect highlighted. Avoid all of the above and none of the above sentences. In all of the above, you only need to have partial information in order to answer the question. In none of the above, as a correct, students are exposed to a lot of incorrect information and may not need to retrieve correct answer. So both question type can be harmful to accurate assessment and possible learning benefits are minimal. After knowing what to avoid when writing MCQs, now it's important to know how to judge the quality of a test. When reviewing the test as a whole, you should assess adequacy of time involved, 60 to 70 seconds per question, number of students attempting each question, the average performance of students in the test. The average mean scores obtained in a question paper with the single response questions is 50 to 70%, and differentiation of students of different ability by standard deviation of the mean score. Then comes reviewing individual questions by two processes: a pre-validation before examination, in which experts rather than the person who wrote the question go through the paper, and a post-validation that is done after the test has been administered and scored, but before the results are announced. It is assessed based on 3 different aspects. Difficulty index, which is equal to the percentage of students who answered the question right from among those who attempted the question. This index will be higher for questions that are easy and lower for questions that are difficult. Ideal difficulty index is between 50 to 60%. 30 to 70% are considered satisfactory. The second aspect is the discrimination index, the ability of a question to distinguish between students. The higher this index, the more the question will distinguish for a given student. Poor discrimination index would include too easy or too difficult questions, questions not pertaining to the syllabus or wrong key. And finally, the last step in post-validation is to examine the distractors and an MCQ for their effectiveness. A distractor is effective if more of the lower ability students pick it incorrectly as the correct answer, and less of the higher ability students pick it as the correct answer. The major problem in constructing MCQs are that very few faculty members have formal training in question construction, and questions are prepared as a context-free during the last minutes where there is little or no time for reviewing the quality of questions before examination.